Joining us for our Wednesday COVID-19 report, where we make an effort to provide information and data, and also to provide hope for Tennesseans in the midst of this crisis. The work that we're doing must both defeat COVID-19 and instill confidence in Tennesseans that we will get through this by way of our efforts. I mentioned hope. You know, hope is a powerful tool in the midst of a crisis. And as many Tennesseans and many across the world celebrate Holy Week, I want to encourage Tennesseans to take hope. In fact, this evening at sundown, millions across the world will be celebrating the historic event of Passover, a day in history when a nation asked God to spare them of a plague, and that plague passed over. As many celebrate this week of hope, I encourage you to ask God to grant favor to the state of Tennessee, to our country, and to our neighbors across the world, and stay hopeful. Before we get started today, we've had a lot of questions regarding the self-employed in Tennessee and our efforts to make sure that they gain access to unemployment benefits during this COVID-19 crisis. The Department of Labor and Workforce Development is currently reprogramming jobsfortn.gov to accommodate the federal program, Pandemic Unemployment Assistance, or PUA, as you've heard about, and the new $600 weekly federal benefit. The department is working diligently to make these changes as quickly as possible so Tennesseans can start receiving both the state and the federal payment. If you're self-employed or an unemployed worker and you have already submitted a claim, you don't need to reapply. All Tennesseans receiving unemployment or PUA will automatically receive the weekly $600 federal benefit in addition to their Tennessee unemployment benefit. Today we're going to talk about two primary things. We're going to highlight our work to gain qualified medical staff for our surge capacity efforts, and we're going to announce a partnership with HealthStream to train those healthcare workers. And we're also going to provide insight today into the deployment of the new Abbott ID Now test for rapid testing that so many of us have heard so much about. First, the numbers. We have 4,362 confirmed cases. We have lost 79 Tennesseans to date to COVID-19. And we have had 592 total recovered cases. As we build surge capacity, which we are doing right now, one of our most important components isn't just finding the sites to build additional capacity, and it isn't just netting additional personal protective equipment and other critical supplies. We have to have qualified healthcare workers to staff our surge capacity in the event that COVID-19 overtakes the load on our hospital. The cases overload our hospitals. In March, I issued an executive order to help get qualified medical personnel back into the game. This executive order loosens restrictions around retired medical professionals so that these qualified individuals can quickly become part of our staffing efforts in surge planning. That executive order also temporarily suspended continuing education requirements for healthcare workers so that professionals can continue working through the pandemic. The Department of Health created an online sign-up for healthcare workers to register if they were willing to serve. We are encouraging and have been and continue to encourage retired and furloughed healthcare workers to sign up through this portal so that you can make the difference in our surge planning in the days ahead. The sign-up's available on the Tennessee Department of Health website, and so far over 800 healthcare personnel have engaged with us through that portal. As we encourage healthcare workers to join us in surge planning, our staff and our alternative care sites, we want to make sure these personnel have the skills that are needed to meet the demands, especially clinicians who are retired and considering rejoining our efforts in surge planning. Unified Command, our group set up to attack COVID-19 through our work with Launch Tennessee, has developed a public-private partnership with HealthStream. HealthStream's a publicly traded Tennessee-based company that provides education resources for 80% of the hospitals in this country. HealthStream has offered its learning platform, its COVID-19 training content, and HealthStream employee support free to the state of Tennessee to facilitate the launch of these alternative healthcare facilities and education for those who will man those for our surge planning. HealthStream has a tremendous reputation, and we believe that their generous offer to make training resources free to these professionals, to the volunteers, and to the returning healthcare workers that will be staffing the alternative healthcare facilities will ensure high-quality care is delivered to patients in Tennessee during the surge. This is another example of one of our great corporate citizens embracing the volunteer spirit and stepping up in a time of need. We are grateful to HealthStream for their contributions to our efforts to attack this virus. Bobby Frist, the CEO of HealthStream, will come up in a few minutes to discuss this partnership and what it means to our efforts to fight COVID-19 across Tennessee. Although COVID-19 has created tremendous disruption to every one of our everyday lives, we're seeing new innovations launch every day that are going to help us defeat this virus. At the end of March, Abbott announced the development of a new rapid COVID-19 test on the ID Now machine. These rapid point-of-care tests show a positive COVID-19 result in as little as 5 minutes and a negative result in about 13 minutes. The development and implementation of this technology will help states all across the country to test more people faster and to chip away at the testing backlog that's been such a problem. Yesterday, the CDC provided our state health lab with one ID Now machine and 120 initial tests. And we're actively working to get more tests and to maximize this technology after we try this initial round. Dr. Piercy will come up and provide more information about our use of the machine during her update. But in addition to the state lab getting access to rapid testing, private providers in Tennessee, again, are gaining access to this cutting-edge technology. With us today, I have Dr. Bruce Irwin, the CEO of American Family Care. American Family Care operates clinics across Middle Tennessee and is deploying the use of this Abbott ID Now at their clinics, and they have the capacity to test close to 4,000 Tennesseans. The aggressive efforts of the private sector once again have helped to make our state a leader in testing for COVID-19. We thank American Family Care as well for their work as we continue to rapidly scale testing in Tennessee. I want to ask Dr. Irwin with American Family Care to come up and share more information about the ID Now test. Dr. Irwin.
Thank you, Governor. It's an honor to be here today. I have close ties to Nashville. My daughter's a Vanderbilt graduate. Dr. Ben Barlow is with me. He's our Chief Medical Officer. We're very grateful to Abbott Laboratory. We have a long-standing partnership with them. We were one of the first companies to buy their ID Now machines to do other tests. It's a multi-purpose test, and when they began to roll it out, since we have 236 offices in 24 states, they looked to us to help roll it out, and we were honored that they did so. We have offices throughout Middle Tennessee, and we also have 11 offices in East Tennessee and over in Memphis as well. So we'll be rolling this out throughout the state as more and more tests become available. We first rolled it out in New York on Long Island and then in Massachusetts. And the third state that we're rolling this out is here in Tennessee. And again, we're very grateful to Abbott. They control what states get it. And we've been fighting mightily for the Southeast, and we're very fortunate that we're able to be able to bring it to all the people of Tennessee. I think Ben can describe how the machine works better than me because he's the guy that's rolled this out. And you know, to go from not having any tests, we did have the machines, thank goodness, but to go from not having any tests to be able to roll it out and be testing thousands of people is quite a logistics problem, and Ben has definitely helped us solve that. Ben, you want to explain the machine?
Sure. So we started by thinking about the safety of the staff, the safety of our patients. So everything before you arrive into our clinic is done online. So your registration, your appointment, and then we text you prior to entering, and you text us back. So when you come in, we're all in PPE. We meet you at the door with a mask. We bring you back to our room, and what we do is we swab the patient. You do it in both nostrils. The machine has been warmed up. You go ahead and mix it in here, and then you take a cartridge and you move it up here to the testing platform. And so we'll get a positive within 5 minutes. Negatives take 13 minutes, but before the patient leaves, we can take care of the patient and know if they're positive or negative. And I've already, in coordination with the state, we talked about reporting in terms of positives and negatives, and we're in close communication with how we're going to do that going forward.
This machine is an amazing game changer, because one of the difficulties that we've had in battling COVID-19 has been the first test that came out, there were some difficulties with it. And the test that we have now can take days to weeks to get back. So very often when we test someone, even if it's positive, by the time it gets back, they're already in the hospital or they're well. So this test, being able to do it point of care and to get tests instantly, literally is going to change the game in our fight against this pestilence.
Thank you. We appreciate your efforts, and as you know, Tennessee has been a leader in testing across the country. We have aggressively pursued additional tests, and this is going to help us to continue our efforts to test, to identify those who are carrying the virus so that we can more quickly slow its spread across our state. I mentioned earlier that HealthStream was going to partner with us and to provide free testing for our oncoming medical staff that will be a part of our surge response in our alternative care centers. And I've asked Bobby Frist, who's the CEO of HealthStream, to come up and share a little more information about that partnership.
Thank you, Governor Lee, Dr. Piercy, Ms. Dolan. The work that you're doing to add additional surge capacity to our already burdened healthcare system is visionary and important to be ready. Let's hope that we don't need it, but I'm so glad to know that you're all working so hard to get it ready. And you're putting Tennesseans in the best possible position relative to the fight we're in with coronavirus, so thank you for that. HealthStream is here today to engage in a public-private partnership, which we're all familiar with here in Tennessee. We always step up and volunteer our services every time we get a chance. And we're here today to solve the particular challenge of onboarding these healthcare workers that are coming from maybe a retired situation back into the workforce. Many of them, they need quick, concise training to be ready and be onboarded into these temporary alternative healthcare facilities. At HealthStream, we have a long history of training and developing the healthcare workforce. We've delivered tens of millions of online courses to healthcare workers across the United States. We're pleased to offer free training and orientation resources to healthcare workers that will be staffing these alternative healthcare facilities. HealthStream has offered, as Governor Lee said, its learning platform, relevant courses on the COVID virus, infection control, and other vital clinical skills training necessary to bring these people up to speed rapidly. HealthStream, I want to thank Dr. Piercy, particularly for your outreach to the private sector, because I think the public-private partnerships are what can make a huge difference in our preparedness for this virus. One thing that I've been encouraged to do today is since Governor Lee has pioneered this public-private partnership model, is to take this model and extend it out to the rest of the country. So the interesting thing today is that HealthStream is in a position through our pilot program with the state of Tennessee to extend this program out to all other 49 states that may need it to prepare for surge training. So you can contact me if you're a governor or a director of public health or a commissioner. Contact me directly at robert.frist@healthstream.com, and we'll put a team on it and figure out how to provision these services to you when you do your surge planning. In times like this, we see why Tennessee is known as the volunteer state. For some, fighting COVID means sheltering at home. For healthcare professionals, it means taking a risk, taking care of the patients that are directly affected. For others, like the 900 employees of HealthStream, it means finding creative ways to support those that are on the front lines of battling this coronavirus. I'm proud of their work. As we say at HealthStream, keep streaming good. It's making a difference. I'm sure that all Tennesseans, along with those in government service and those running companies, are fighting to crush the coronavirus. Thank you, and let's do this.
Thank you. Thank you, sir. Thank both of these companies for their efforts. We are continuously encouraged by the efforts of the private sector, the nonprofit sector, and those all across this state, individuals as well who are volunteering, who are donating, who are putting forth a great effort because we have to attack this together, and we are in fact doing that. And I want to just make an additional, I want to offer additional thanks to our healthcare workers. We've talked a lot about the surge and additional workers and training those workers. They are in fact putting themselves in the line of fire in this COVID-19 effort. And we support and encourage and thank the healthcare community for what they are doing in this state. We are going to win this battle, and we are making tremendous strides toward that. We're making tremendous efforts. As we said yesterday, and we'll continue to say, we're very encouraged by what we're seeing. It's all the more reason that we each individually in Tennessee need to stay the course, need to double down, need to make certain that we continue to do everything individually that we can so that all the efforts of everyone coming together will be most effective in attacking COVID-19. I'll ask Dr. Piercy now to come up and share her health update, and then we'll have questions.
Thank you, Governor. Before I get started, I want to acknowledge again Mr. Frist and HealthStream for the extraordinary gift they're providing healthcare providers in Tennessee and now nationally. Today's case count is 4,362. The good news is that is the 5th consecutive day with single-digit growth. That means what you're doing is working. Keep it up. Good job. We do have 449 hospitalizations, which is up, but that's what we talked about earlier this week is to be expected. 79 deaths, which is up 7 from yesterday. The good news is we have now done almost 57,000 tests. Talking about testing, we do have a growing capacity. We just heard about the Abbott ID Now platform, and I'll speak just in a moment about how we're using that at the state lab. But the bread and butter of testing is still the traditional, what we call PCR test. Fortunately, we've been able to secure a supply chain on that, and I was able to distribute almost 10,000 swabs to our local health departments today. So we should be catching up with that demand very quickly. As far as the Abbott ID Now, the governor referenced that we got in 120 tests yesterday. We are already starting to use those, but we are saving those because of the limited supply. We're going to use those for somewhat emergency purposes. So in those traditional tests, those take 4 or 5 hours to batch, and we do a few batches per day. But if a sample comes in that needs to be prioritized, like nursing home, hospitalization, or healthcare professional, we can use that off-cycle in order to turn around quick results. We do anticipate growing capacity in the month of April on that rapid platform and look forward to growing that. Finally, I want to follow up on something we talked about yesterday, which is the new race and ethnicity data on our website. You will see that the positive tests are now broken down by race on our website in a chart that reflects the same methodology that the CDC uses. What's really important to remember when you look at this is that our goal here is to make sure that every Tennessean, regardless of race, zip code, socioeconomic status, or any other category, has equal access to testing. I also want you to realize there are some limitations with that data collection process. The race and ethnicity data that we gather is person to person. That's through contact tracing. By and large, that does not come to us through test results. That comes to us when we talk to patients. And so you will see that the largest percentage on our website is pending or unknown. Some of that is a data lag, and we'll be entering that over the next few days. Some of it, we either haven't been able to contact the person because we just can't reach them, or there are, in some instances, people don't want to give us that data. So there will always be a percentage of unknown or pending, but we do know that the race data that we have is helpful to us to making sure we have across-the-board access for every Tennessean. I'll stand by for questions if you have any.
Thank you. Thanks again, Dr. Irwin, for being here with American Family Care. He'll be available for questions. Bobby Frist with HealthStream will also be available. Our Unified Command Group is here, Dr. Piercy and others, so we will be happy to open the lines up for questions.
Thank you, Governor. Well, first we'll go to Brett Kelvin with the Tennessean. Brett, your line is open.
Hi, everyone. Thank you for the updates. This question is actually for the officials from American Family Care. I see that you guys have 20 locations in Tennessee. Do you have 20 Abbott ID tests and are able to put a machine at every location? Or are you going to have locations where this test isn't available?
So we have started our Spring Hill location in Nashville, and we have started testing there, and then we're going to spread out to the rest of the state. And we have a timeline for training and implementation that we're doing currently.
Yes, how many machines? Machines at each unit.
Oh, so we have about 10 machines at each clinic.
But just the Nashville Spring Hill Clinic right now.
There are 10 ID Now machines at the Spring Hill Clinic right now being used.
And the other clinics now.
Yep. And all clinics around Nashville, they are starting today, and we're taking appointments, and we're seeing patients at those clinics also.
Thank you.
Yeah.
Next, we'll go to Jonathan Mattice with the Associated Press. Jonathan, your line is open.
Hey, Governor. I had a question today. I guess Trousdale Medical Center has suspended the vast majority of its services because there were some positive tests there, except I think ER services. I wanted to see, this might be for Dr. Piercy, how many folks, staff, and patients have tested positive, who is being tested there, and sort of what the outlook is at that facility.
Do you have information? Have there been reported yet?
Hey, Jonathan, that's the first I've heard of an outbreak at Trousdale, and I'll take that as an item for follow-up, and we'll be sure to support them in their efforts there.
Thank you.
Next, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
Yeah, I guess getting back to Dr. Irvin, is where are your centers located in East Tennessee, and do you have any in the Chattanooga area, and when do you think those might be online?
Yes, we have four
You'll have to step up here if you don't mind. That's all right.
We have 4 clinics in Chattanooga, and we have an additional 4 in Knoxville. And they should be online in the next 10 days, week to 10 days, as we can move the machines around the country and get them all in the places where we have the test.
All righty, thank you.
Thank you.
Next, we'll go to Sergio Martinez Beltran with Nashville Public Radio. Sergio, your line is open.
Thank you, Gilam, and good afternoon, Governor. Thanks for answering our questions today. Commissioner Piercy said that the goal of the state is to make sure that every person in Tennessee has equal access to testing. That's why you're getting this data on race and ethnicity. But exactly how are you going to ensure that everyone will have access to testing?
Well, I'll let Dr. Piercy add to what I say, but what we are making efforts in every community through health providers with our departments of public health that are available in every single county, through communicating, through efforts like these daily press conferences to remind people that testing is very important. It's a key component of addressing COVID-19. So in regions, particularly in some of our urban centers, we have made certain that we're reaching out to nonprofit providers in those communities. I had a call yesterday with pastors and encouraged 400 or so pastors around the country, around the state, encourage them to make sure that they communicate with all of their parishioners, all of the members of their churches, that how important it is that they follow guidelines, that they pursue testing when necessary. We're trying to get the word out that testing is important for every single Tennessean, no matter where you live, no matter what zip code you're in, no matter what your status is. So our efforts at pursuing this have been very important, and this data will give us some insight into whether or not we are proportionately testing folks in every demographic.
Hey, Sergio, I appreciate that question because it allows me the opportunity to brag on the great efforts going on across Tennessee, both in the public sector and in the private sector. You'll notice over the last few days, we have added 4,000, 5,000. Yesterday was 5,500 tests on a daily basis to the denominator. That's remarkable. I'll be honest, I don't know how that compares exactly with other states, but I know we are one of the leaders. Likewise, we have spent nearly all day today talking about how we can take our testing to the next level. And so I think you will see over the coming days and weeks, we will not only continue to lead, but we will be one of the preeminent testing states for every Tennessean in absolutely every category because it's that important.
Just to follow up, does this mean maybe spending more money in specific areas where you see more people testing positive?
Oh yeah, we're increasing our efforts, which means that we're doing additional spending and getting those tests available to every area in the state. This is a part of what's most important. Therefore, our resources, including financial resources, are being spent on expanding testing. And again, we're reaching out to communities that we want to make sure we're penetrating with testing, and we're finding those members of that community that can speak directly into those communities, whether it's rural or urban or suburban, to make sure that folks all across this state understand how important it is that if they qualify and if they present and if they need to have a test, that we can make it easily available for them. I'm pleased to say that no one's being turned down for testing that qualify in our state right now, and we want to continue to make that even more available.
Thank you.
Next, we'll go to Jordan Ferguson with WTVC. Jordan, your line is open.
Hey, Governor, thank you for taking questions. So I have a question for the people with Abbott. Today, Hamilton County Mayor announced that they were on track to receive testing for the rapid test, but they've now been pushed back to May. Do you know what was sent to another place? They said it was sent to the testings were sent to another place. Do you know why and when other counties are expected to receive those tests?
Okay, so let me just be clear. The folks with us today are from American Family Care, and that's a company that has received from Abbott these tests and these machines, and they're using they're distributing those tests through their clinics across the state. So, could you clarify your question about the receipt of those tests and for our state?
Yeah, Hamilton County Mayor says that Abbott, they were expected to receive the test this month, but it's since been pushed back. They won't receive it till May. The hospitals won't, not American Family Care, the hospitals.
Well, I can answer that partly, this Dr. Irwin, based on what I've been told in our communications with Abbott, and we talk to Abbott several times a day. The limiting factor is, or has been, the machines, because unless you had the machines in place, you would not have the technology to do the test. And they're limited at how fast they can manufacture those machines. And then on top of that, they had to develop a different technology to be able to perform the test. So they prioritize, they want to get the test out as rapidly as they can throughout the entire country. So they prioritized, of course, getting the test to the companies that already have the machine, which, as I said earlier, we had bought several thousand of the machines a year or two ago to run other tests on. So it's going to be, and they have a formula where they're prioritizing areas of the country. I do not know their formula. They won't tell it to me, but it's, I do know that we got tests for Long Island in New York, and we have tests for Massachusetts, and they've given us the tests for Tennessee. And our home office is in Alabama, and we haven't even gotten any tests yet.
I'll add something to that. I was on a call today with the National Governors Association, governors from all across the country, and we were discussing this Abbott machine and the tests. And the federal government allocated machines from Abbott. There's just a limited supply of these machines. They have been ramping up their manufacturing process, and they are making the machines as fast as possible, but there's a limited supply of them right now. So they're being allocated to individual states, particularly the states that have the greatest, that are real hotspots in this country, are receiving more of those machines because they need them more. So I know that there's a distribution of these all across the country. Every governor was talking about the allocations that individual states are receiving. And so we're fortunate that in our state we have access to more tests than most states do, because most of them are just receiving the initial allocation from the federal government. But that's the limiting factor. This company has just begun manufacturing these machines on large scale because of this COVID-19 pandemic, and there's a limit to the extent to which they can manufacture them, but they're getting them out. My understanding is they're getting them out as fast as they can get them made.
Thank you.
Next, we'll go to Phil Williams with News Channel 5. Phil, your line is open.
Good afternoon, Governor. I just have a clarification that I'm looking for on a couple of issues. First of all, on Monday, Dr. Piercy said that what we are doing is working, and, quote, this is not a time to let up on those efforts. Yet you were asked if you would continue the stay-at-home order when it expires in less than a week now, and you said you were not looking to extend that right now. Can you provide some clarification? If it's working, why are you not looking to extend it, especially since the peak is well over a week away?
Yeah. So I said that I had not made a decision about whether or not to extend that, and we won't make that decision until we see the specific data. As you know, data changes every day, and we watch it every day. And we have, over the last 3 weeks, made decisions based on that changing data. So as of now, the date for that order is next Tuesday night at midnight, and we will watch the data. And it is, in fact, seems and appears to be working. That's really good news, that what we have done, and it's not just this order, but the steps that we have taken from the very beginning, including testing, our acquisition of PPE, the initial order that closed bars and restaurants, the previous orders in the major cities, all of those efforts have had a profound effect on the movement of Tennesseans, but also on the slowing the spread of this virus. And that really is the goal, is to flatten the curve. We know we can't stop this virus, but we can slow it down to the point that we have adequate capacity in our healthcare system. That is something that we look at daily as well, and we're making real strong efforts to make sure that we have that capacity. We talked a little bit about that today with healthcare workers. So it is working, and we are very encouraged about that, and we will continue to watch that as we make decisions about extending or not extending, about how to make new decisions based on the information that'll come.
And just one other follow-up. The models, as you noted, look more promising as far as hospital capacity. In what ways are those new models affecting your surge planning, such as the number of contingency beds?
Yep. We are planning for surge planning. For example, what we're doing is trying to provide for flexibility. So we have the Corps of Engineers assessing sites, and they're looking at sites that we can fully build out, partially build out, sites that we can build out in a very short period of time, some that will be available for us for a longer period of time, because we know that even if we have a surge in the next week or two, that this virus is not going to disappear until there is a vaccine for it. And so we also have to think about the future and about what life is like in Tennessee in the weeks and months ahead, and planning for the kinds of infections that might be there, even though there's not a surge. So all of those all of that has played into our calculations on how much hospital bed excess capacity to create or to provide. And we are going to provide excess hospital bed capacity. We're just trying to make determinations right now on how much of that capacity based on the models that we're getting. And those models are changing. We use a multiple, we look at multiple models to make those decisions, and that's an ongoing thing every single day.
So you may not build out as many beds as you had initially expected to?
That's right. We initially talked about building out 1,600 beds, and we're talking to healthcare providers every day, including yesterday and today. Particularly, I'm talking about Nashville, for example. We're talking to healthcare providers today about what they believe. We're still moving forward with our plan, but we're talking with them today about what we think their capacity is actually going to be like in the surge. And so what we're working to do is, while we're planned for a facility that will hold 1,600 beds, we may not build all of it out on the very first go round. So we're evaluating that every day, trying to make sure that we don't improperly develop surge capacity. But we also know that we need to have surge capacity. We want to be safe. We want to be certain that we have it, even if the models are not showing that we need it. We know that models have changed, a lot in the last several weeks, and so we're going to plan for a surge.
Next, we'll go to Caressa Jackman with WSMV. Caressa, your line is open.
Yes, good afternoon, everyone. My question is both for the Department of Health as well as Governor Lee. The CDC announced today that African Americans make up a third of people hospitalized with the coronavirus, but only 12% of the U.S. population, and they're more likely to have severe cases due to higher rates of diabetes, asthma, hypertension, things like that. I would like to know what the state do. What is the breakdown of race? I know that it's online, but if we can announce it so that people can hear it ourselves. And then number two, what would you like to ensure the African American population that we've got your back? You don't have to be worried about going to the doctor. You don't have to be worried about not getting the treatment that you deserve. What message would you like to send?
Thank you for that question. On our website today, you will notice that of the cases that we know about, or of the positive cases, 26% are white, 7% are African American, 2.5% are in the other category, 0.5% Asian, and 63% pending or unknown. I referenced that earlier of why that is, and we'll have better data as the days go on. But to your second question about higher hospitalization rates, you're exactly right. People with underlying conditions, particularly diabetes and hypertension, do have a harder time with this virus. They are more likely to be hospitalized, and they have poorer outcomes than people that don't have those chronic conditions. Unfortunately, Tennesseans have higher rates of diabetes and hypertension, and our African American Tennesseans have a higher than average rate even in Tennessee. So the most important thing that folks can do, not only take care of your own health conditions, follow your doctor's instructions, take your medication, all of those good practices, but if you believe you're ill or you have been exposed, get tested, because the earlier you can get tested, the earlier you can get treated, and that's going to improve all outcomes.
Next, we'll go to Alex Apple with Fox 17. Alex, your line is open.
Hi, Governor. There's a Tennessee company with more than 1 million antibody tests that could tell if someone's been infected by the virus. It also shows that they've potentially developed some immunity. So with those tests, you might be able to get people back to work and get the economy going even without a vaccine. If they have 1 million of these, and they've told me that they want Tennessee to lead on this and take care of this testing, they want to give them to Tennessee first and foremost. Are you willing to let Tennessee kind of be the leader on getting that testing widespread? And do you view that as a way to open up the economy pre-vaccine?
Thanks, Alex. I'll let Dr. Piercy talk specifically about the antibody testing, except that we know that will be a very important component going forward. Knowing who has had the virus by testing antibodies will give us a lot of information about how it is that people can move around, knowing whether or not they've had the test. You might comment about the million tests.
Hey, Alex, we've been talking a lot about antibody testing today, too, in our overall testing scheme. So right now, there is only one antibody test that has been approved by the FDA. That has just been in the last few days, and that test is not yet on the market in production. I do anticipate that coming hopefully in the next week or two, but with all of our supply chain issues, it might be a little bit longer than that. I am aware of a couple of additional antibody tests by Mayo Clinic and CDC that are in development. But as far as these in Tennessee, all that stands between us and them is FDA approval. So we encourage any Tennessee company that has the capability to pursue the FDA process so we can use those here in Tennessee. And this will absolutely change the testing game. Most of these antibody tests are finger sticks. Some of them are blood draw, but they have results pretty quickly, usually in 15 minutes on the spot. And you're exactly right. It does help us know which ones have more likely to be immune to the virus and can move about freely.
Do you know how long the FDA approval might take, Dr. Piercy?
They have issued what's called an EUA, Emergency Use Authorization, and they have significantly sped up that process, and I believe there's actually even a 15-day window where after some initial vetting, you can actually go ahead and start using that product even while you're waiting on full approval.
That's all the time we have for questions today, Governor. If you would like to make a closing statement.
Thank you for being here today. Thank you for allowing us to give you more information. We hope that's been helpful to you. We will continue to provide data, information, to continue to communicate with you about the efforts that we're making. We're, again, proud of our private sector companies that have stepped up to help us. We are grateful for the many companies that have come together, but we're mostly grateful for every one of you who are doing what it takes to make this happen. We are encouraged. We do have great hope about the outcomes in our state, and it's happening because of your individual efforts to do what you can to help your neighbors, to help the elderly and the vulnerable populations, to help get the word out that people need to be tested, and to do your part to stay apart. Thank you very much.